Meanwhile, Karnataka is seeing a serious surge with Bengaluru cases exploding. Breaking all records, Karnataka reported over 39,000 new infections in just the last 24 hours. With this surge, the active case tally in the state has now risen to over 3 lakh mark. That's not all. The state also broke its pandemic death toll record after it reported 229 deaths in just 24 hours. So far, 14,807 people have lost their lives to Covid-19 in the state of Karnataka, leading to a surge in the state. Bengaluru itself reported over 22,500 cases today, its highest since the outbreak of the pandemic last year. Now we're looking at Bengaluru after Mumbai, the worst hit city in the country. We're looking at, in fact, at one point, Bengaluru surpassing the toll that of Mumbai. We're looking at a surge in the cases, of course, in Karnataka, owing to people moving in and out of the state over the last few months. The bypolls that took place in Karnataka, of course, Tamil Nadu elections as well. People were going in and out of the state. Eventually, Bengaluru itself, the city, the capital of the state, has led to a serious spike. We're looking at over 22,000 cases in the last 24 hours. And this has been consistent in Bengaluru for the last 1 week. Fresh infections, 39,047 altogether across the state of Karnataka in just the last 24 hours. Here we're looking at Karnataka seeing a serious surge where overburdened healthcare infrastructure, similar situations as that of Delhi and Maharashtra. We're looking at same scenes also witnessed in Karnataka, particularly in Bengaluru. Oxygen supply shortage, lack of beds, people still running pillar to post to find an ICU bed. Here are situations in Karnataka as well that are as grim. Nolan Pinto joining us for more details on that. Nolan, please take us through. We're looking at Bengaluru now being the worst hit city in the country possibly after Mumbai, or maybe even has surpassed the Mumbai toll as well. If you can give us some insight into what has led to this sudden surge of cases in Bengaluru and Karnataka as well.
Well, Nabila, out of the 3,20,000 odd active cases in the state of Karnataka, 2 lakh plus active cases are from Bengaluru urban itself. Now, this is the major hotspot. And we must remember, this is the place where you have a lot of IT companies. This is the place where you had a lot of people coming in from different states as well and from different districts. Now, that's the reason, one of the reasons why the government decided that a lockdown is necessary in order to cut the chain. They also have actually stopped people from moving to various districts. All this is being done because of the numbers. However, one important point to be made was what Revenue Minister R. Ashok stated. He said that as of now, he has information that some 2,000 to 3,000 odd people have switched off their phones who are in home isolation. So the government has lost track of them. They do not know where they are. He believes that it is because of people such as this that the cases are surging in the city. They have no information as to where they are, if they are out, if they have actually gone and met people. He says that it is these same people who switch off their phones when they have mild infections, and when things get bad, that is when they switch on their phones and start contacting everyone to get a bed. So he's requesting people, please keep your phones on. Medicines are being provided for those in home isolation free of cost. So the government is taking very strict measures, but on the ground, lack of hospital beds, people are still struggling to get oxygen. No doubt it's not the level like you're saying in Delhi where people are standing outside. It's not like that with their oxygen cylinders, but still they are struggling. Volunteers on the ground tell us that they have to struggle a lot to actually get oxygen for all these people.
It's absolutely shameful, to say the least, if people are not adhering to the COVID protocols. If you are positive, you've got to stay indoors. If you're switching off your phone and stepping out, it is shameful, criminal, as good as murder. Here we're looking at a pandemic that's consumed the entire country. Karnataka also seeing a serious surge. It's a request going out from the medical fraternity time and again to show collective responsibility, stay indoors so we can curb this virus right here.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.